Hello, I'm Dr. David Oster. Welcome back to Oster Oncology, where it is our goal to help cancer patients fight stronger and fight smarter. That's by the use of integrative oncology, the incorporation of natural compounds, natural medicine brought in conjunction with your conventional treatments to help you tolerate your treatments better, and also bringing in this additional evidence-based anti-cancer benefit that natural compounds can deliver to patients. It is February, and it is National Cancer Prevention Month. And so with this talk, I wanted to put together a really concise, packaged talk for you to speak of all the different elements that are involved, all the factors, modifiable factors that we know are involved in cancer prevention. So it's good timing. This past month in January, this prior month in January, I was able to host a workshop. It was a 4-week workshop here in Boulder, Colorado, and one on integrative oncology, and one of the sessions was on prevention. So for 2 hours, we really dove into all the statistics, the evidence, the numbers, and all the different elements. So I'll share you, hopefully in just a really concise nutshell today, not 2 hours, but I'll give you the bullet points of it, and you'll be able to have that from this talk today. But one thing that I wanted to share, again, first off, is the response that usually happens when we talk of prevention. When we look at the numbers of how much cancer is self-inflicted, really, it's a bit of a shocker. We get this response of it. It's a little daunting. A bit of a head shake in the audience and jaw drop that we're doing so much of this to ourselves. We'll get into the numbers in a second here. But very quickly, usually that's the first reaction response, but very quickly it's only one side of the coin. The other coin is that though it can be such a concern that a lot of this is self-inflicted, the other side of that is that therefore they are modifiable. We can address them, we can be intentional with them, and therefore hopefully at the end of this talk you'll be able to feel hopeful that there's a lot of things that we can control. So that's the first point before we get into the numbers. The second thing is that when we speak of prevention, none of these are guarantees, obviously. So it's not uncommon when we speak of cancer prevention to hear somebody say, yeah, but, and everyone has this story, and I've got 100 stories. I've got hundreds of stories of patients that when you sit with them and they've done everything right. So how did cancer actually come into this person's story, into their life? They ate right, they were at an ideal weight, they are physically active, they avoided all the known carcinogens, and so forth. And so though those cases do exist and you scratch your head, that said, what I'm going to share with you today, all of it is very much backed up by a lot of data, a lot of evidence, and we know these are important factors to consider and not just dismiss. And so we'll go through them all today. And again, it's a video. I'm going to hopefully fly through this quick to keep it short and sweet for you. And then, of course, it's a video, so you can pause it and go back and get some of the details as I fly through this. Okay. First off, it is estimated that a little over 50% of all cancers are preventable, or they are all attributed. They can be attributed to modifiable, avoidable, preventable risk factors, that if we just remove them from our culture, from our own lives, then over 50% of cancers, new diagnoses, would drop. Okay. Last year, 2019, the number of new cases of cancer worldwide across all cancer types was roughly 17 million new cases. Okay. So if we dropped that by a little over 50%, the estimates in a few studies from 2018 and from the American Association of Cancer Research in 2016 put out a report, again estimating the same 50% drop in cancer incidence. We could be preventing 9, maybe 10 million cases if we could actually get on top of these modifiable factors. So it's a big number. 50%, and that's usually, again, the jaw-dropping, how could we be doing this to ourselves reaction that we see. But again, I want you to hold on to, as we go through this, these are things that we can take a personal inventory in our lives, in our families' lives. What are we doing to avoid these, okay? Before we get into the factors, the most preventable cancers seem to be and this probably isn't a big shocker to you, but the first one is lung cancer, colorectal cancer, liver cancer, and then breast cancer. Okay. So the numbers vary dramatically though. So the numbers are huge for lung cancer. So 85%, estimated 85% of lung cancers are preventable, and I'm sure you know the culprit. Number one would be smoking. The liver cancer, 71% seem to be preventable. It's a smaller overall number of cases compared to lung cancer, of course, but so much of it is self-induced, typically hepatitis and cirrhosis leading into liver cancer. Colorectal cancer, a little over 50% of cases we know can be attributed to avoidable factors. And then breast cancer is actually quite lower. So breast cancer is 29%, 29 to 30%. It's really important to actually share that number with breast cancer patients, new diagnoses coming in, especially those that seem to have done it all right. And they're trying to again do a self-inventory of how did this go wrong? How could I be sitting here with a diagnosis? And so much of it, over 70%, is still a question mark on why we see breast cancer in our culture. The number one factors, number 2 and 3 factors that are causative factors for cancer in our culture, number 1 is smoking. Not a big surprise, of course, it's correlated with lung cancer, but also the urinary cancers as well, bladder and kidney cancer, renal cell. Other avoidable factors that are the primary culprits after smoking, the second one is obesity. And we're going to touch on this a little bit further, but obesity is highly causative, correlative to cancer incidence. After that is a long list, but we can all put them in this dietary category, where we can look at fiber, plant intake, the type of fats and oils we're taking in, and such. Okay, so we'll touch on that as well. Other would be ultraviolet light, of course, with skin cancer, and viruses as well. So hepatitis B, hepatitis C, human papillomavirus, and then another factor, of course, correlated, we'll touch on this again today just quickly, is physical activity or the lack of. Okay, so those are the main factors. We're going to dive into them right now. So we'll start with lifestyles. There's 2 of them. One is sleep and the other is exercise. So again, we know highly correlated quality of sleep, duration of sleep, linked to breast cancer, clearly prostate cancer, colorectal cancer, and the list doesn't end there. The main link, the main understanding that seems to underpin why is sleep so important, of course it does a lot of recuperative things. The body recoups and repairs during a night's sleep, and it's an immune booster, so our immune system is recharged at night as well, so there's some of that involved. But the primary piece to this is typically a little hormone called melatonin that we release from a little gland in the brain called the pineal gland, and it is only released during deep quality long sleep. Physical activity. So physical activity is a big one, and it has sort of 2 prongs to this. The first one is that even if we aren't losing weight, even if we don't get the weight reduction that we're looking for, physical activity alone, independent from weight loss, seems to have this correlation with decreased incidence. So those that live a sedentary lifestyle, that are not physically active, have increased risk of certain cancers. And the list is long for that. It's breast cancer, colorectal cancer, renal cell, endometrial, the list goes on studies that have linked sedentary lifestyles to the incidence of these cancers. The other piece to physical activity, of course, is weight loss. And weight loss, getting from a state of obesity or being overweight down to more of an ideal weight bracket for your height, for your body composition, is also highly correlated. Okay, when we look at reduction in the fat tissue we have in our body, so the adipose tissue or fat content on the body, the reasons behind the correlation are very clear. And we know that the greater the fat content, the more we have production of certain cancer enhancing, accelerating factors that are released from the fat tissue. They set up a very favorable environment for the progression and the advancement of cancer. Cancer likes to receive from fat tissue what fat tissue has to offer. And it comes down to hormones. So we know that estrogen levels are contributed to from fat tissue, especially in estrogen receptor positive breast cancer cases, and especially postmenopausal. So in that clinical scenario, getting down to an ideal weight is very important, again, because the fat content increases the estrogen production and concentration in the body. So I sort of call this hormone feeding. More fat tissue increases this hormonal feeding potential to cancer cells. After that, we know that another little molecule called a leptin, L-E-P-T-I-N, leptin is released from adipose tissue, from extra fat tissue. And again, the more we have on, the more factories we have for this leptin on our cells, and leptin levels rise. Leptin is a very potent growth stimulant to tumors and cancer cells. Third piece to the fat tissue is inflammation. So there's certain inflammatory compounds that fat tissues can again be factories for. Interleukin 6 is a primary one, tumor necrosis factor alpha, and there's others as well. And so again, when these are released by excess fat into the circulation, it favors an environment that cancer cells do well within. Okay? All right. Another piece to the physical activity is blood sugars. So we know that there's a clear correlation with elevated blood sugars, diabetes, metabolic syndrome, and the increased risk of developing cancer as well. So that's another piece to the exercise. The next piece is diet. So diet is so influential. The numbers are quite significant. Again, this is to decrease the incidence. This is not necessarily to fight cancer itself. A lot of this is transferable, though, just as a side note, to anyone who has already received a diagnosis, walked through treatment, and they're in a remission period, a survivorship period, you are cancer-free. These dietary factors we can extrapolate that to that clinical scenario as well and translate it over. That we think a lot of these factors, again, sleep, exercise, can also impact decreasing your risk of recurrence, which is another area of prevention as well, right? Okay, so back to diet, Mediterranean diet. If we look at any diet that has the most research backing its ability to decrease across large population studies the incidence of cancer, it's the Mediterranean diet. So the Mediterranean diet, its virtues they match up beautifully with all of the detriments of the Western diet, okay? So when we look at the Mediterranean diet, what are the qualities of it? Of course, we have high plant intake, vegetable intake, right? We have really healthy meat choices, so it's not a vegetarian diet. There's meat going on there, right? But it's healthy meat choices, low processed foods, low excess sugar intake, and probably the greatest virtue of the Mediterranean diet is the oils that it takes in. So in the Western diet, we know that we are very high in inflammatory processed oils. So the oils that we use for our processed foods are usually very highly inflammatory oils and fats. So things that you may think are good, I've even seen it. We were looking at some organic salad dressings during the workshop, actually, and looking at the ingredients of them, and even organic, things that you would buy at really good at health food stores, even, that the oils that are used, because they increase the shelf life, they don't break down, they don't spoil, are things like safflower oils, sunflower oil, canola oil, and these oils are all high in omega-6. Omega-6 fats versus omega-3 fats. So the Mediterranean diet is high in omega-3s. Processed Western food is high in omega-6. Omega-6 we know feed and promote a body environment that cancer very much appreciates and does well within. Omega-3s are anti-inflammatory and they do not feed cancer processes as the omega-6 do. And so this is a great watershed and probably the greatest factor that Mediterranean diet offers when we're looking at cancer incidence and risk rates, and that is the drastic difference between the types of oils that the Mediterranean diet offers. So we're talking what type of oils? We're talking about olive oil. So there's clear studies with olive oil decreasing incidence, mostly of breast cancer is where the research is coming from. Take in a lot, make your own salad dressings, olive oil based. Take in as much as you can. Fish oil is another good option as well. Other add-ons to the Mediterranean diet, guys out there, I'm talking a lot about breast cancer, but here's one for prostate cancer, lycopene. Lycopene is a beautiful little compound found in tomatoes. You can get it in tomato sauce, certainly tomatoes, tomato juice. Ketchup has it too. It's still in its active form. So if you're getting in lycopene, there's clear correlations with lycopene intake and the decrease in the incidence of prostate cancer. Button mushrooms, we know, act like aromatase inhibitors. For those of you that are familiar with breast cancer treatments, there are a class of drugs called aromatase inhibitors for estrogen receptor positive breast cancer. And button mushrooms, not as potent, mind you, so it's not a substitute. I'm not saying you can do button mushrooms and stop the medications from your oncologist, but we can add in these button mushrooms because they also act as aromatase inhibitors. So another thought there as well. Some other studies indicating that certain nuts, particularly walnuts and almonds, seem to decrease the incidence of breast cancer as well. So there's a lot of little add-ons there. But if you were to focus on anything and do an inventory of what are you doing with your foods, look up Mediterranean diet, its virtues, and sort of match it to what you're doing yourself. And if you can make some corrections in that direction, that's the primary one that you're going to be looking at when you're considering what can I do with my food. Side note on the dietary piece, you may have heard of other types of diets. A ketogenic diet, paleo diet. I use these with patients. They are probably the diets that I like the most when I really want to get an individual that is overweight, that has excess weight on them, down to an ideal body weight. If we really want to do that, and if a patient's up for it, they take a little bit more effort, but they're beautiful in that regard. You may have heard that ketogenic diet is actually this cancer cure. And so there's a little bit of buzz around that. You may have heard that. I just want to let you know there's really no research to that. It's usually framed and packaged in this idea that cancer is not a genetic problem, but cancer is a metabolic problem, that the cell's metabolism is different. And that's really where the problem of cancer lies and the solution lies. And therefore the solution is the ketogenic diet, which changes cellular metabolism, which it does. But again, that sort of framework is a little misleading. Yes, cancer cells have different metabolism, but it's based on this underpinning, very much accepted understanding of cancer, that it is not just a metabolic problem, but it is genetic mutations, of course. So we have genes that are mutated, which therefore then change the metabolism of a cell. But by correcting the metabolism through dietary intervention doesn't correct what's already been damaged in the genes. And so just to, again, walk you through that, if we were to look at any type of diet for prevention, it would be the Mediterranean diet. Okay, common factors to avoid. If we were to make a list of things to avoid that have been clearly established as carcinogens. Now, these carcinogens are, when we say carcinogens, we mean that they directly cause damage to the DNA. Again, mutations to the genes are the problem, which then confer survival advantages, exaggerated cell life advantages to a cell to give it these malignant potential and abilities. And so if we're looking at direct carcinogens, the number one, not a big shocker, would be the thing that we already mentioned at the start of the talk. Number one factor is smoking. So the carcinogens that are inherently in cigarettes, again, of course, there's the local damage to tissue in the lungs that can create cancer and malignant growth in the lungs, but they also become water soluble, brought to the kidneys, and then that same, of course, in the urine is temporarily stored in the bladder and washing the walls of the bladder. And so we see urothelial bladder cancers, and we see renal cell kidney cancers as well, highly correlated with smoking. But of course, we see breast correlated with it, colorectal and prostate as well, and others as well. So smoking is the number one thing to avoid. Number two, definitely shown in the research that pesticides increase risk of cancer. So we know, particularly we see it again with the renal cell, bladder, and prostate with pesticides. So whether it's from agricultural spray, if it's in the community that things are being sprayed, herbicides and pesticides, whether it's in your food intake, there seems to be some correlation with golfers even. So those that are working on golf courses or golf a lot, and the pesticide use, they're increasing prostate cancer risk. Plastics, bisphenol A. So we know the bisphenols, BPA. There are other bisphenols though. It's not just BPA. There's a long list of bisphenols. We know that they are estrogenic. They stimulate estrogen receptors. So there's an issue there with breast cancer, as well as carcinogenic. They can damage genes. They have that potential in them as well. So plastics, cooking with plastics is the big issue. So always consider that. Another would be, again, related to food and cooking, would be charred meat. So charred meat you need to be careful with. We know that it's correlated mostly with the gastrointestinal cancer. So pancreatic and colorectal cancer are related to when you're blackening your meat. If it's been on the grill too long, you need to get that black stuff off and just make sure that you're not overcooking your meats. Last one for food that I'll mention is nitrates. So nitrates, of course, are clearly related to a long list, including pancreatic cancer, a long list of cancers. So they are intentionally put into processed meats because they are preservatives. So what I usually recommend my patients or anyone that I'm talking about on this topic would be to go to your local butcher, and typically they will be using nitrates if they're linking their own sausage and making their own meats. However, ask them if there's any product that they make that they're not using the nitrates, and try to get that as much as you can. Also, if you're living in farmland, if you're living in an agricultural zone in rural areas, you need to check your well water. So nitrates can also be found. Nitrates can be found in the runoff from fields, either from fertilizer itself or from the manure if there's a lot of livestock in your area. So get your well water checked. Lastly, if we focus on supplements, a lot of patients are like, is there any supplement that I can take my whole life and it's been correlated to decrease my risk? I would leave you with one, because there is only really one. A lot of other natural compounds that I'll speak on in other talks have been shown to be active with the potential anti-cancer benefit in active disease. So actually against established tumors in patients, an impact there, which is great. So could we translate that back and say, hey, if we took this, could it also prevent? If it's active in active disease, could it also be preventative before disease? Maybe, but we just don't have the research to actually claim that strongly. There's only one supplement that does have that, and it's a vitamin, and it's vitamin D. Now, the correlation with vitamin D and decreasing risk of cancer is not necessarily about how much, it's not even in milligrams really, it's in international units, but the dose that you daily take. It's not based on the dose you daily take or how much you get out in the sunlight. The correlations are always, the studies are always showing the correlation between a certain blood level of vitamin D, which can be easily checked by your physician, and the decreased risk or the increased risk of incidence of cancer. So the studies, again, most of them are looking at breast cancer, but this has been correlated again with colorectal cancer, pancreatic and prostate cancer as well. Vitamin D levels, the higher they get, the lower the incidence of these cancers. The normal range for vitamin D is in nanograms per mil. So it's from 30 to 100 is the normal range. So some physicians, if you come in and they measure it, it's 31, they're like, you're good, you're in the normal range, okay? But the studies seem to tease out and parse out, even within the normal range, there is a great difference between where you find yourself in the normal range and your risk of cancer. So one study was in 2018 with breast cancer, and looking at, within the normal range, stratifying these women by 10, by units of 10. So from 20 to 30, that's deficient, 30 to 40, 40 to 50. This is not a dose, this is blood levels. And the decrease was steady, that the higher you went up in the range to a certain sweet spot, as soon as you hit the sweet spot within the normal range, then the incidence fell right off. So within the normal range, what I like to encourage my patients to get to is somewhere in the 50s to 60 nanogram range and up, because that's where we see the incidence drop off dramatically. In this one particular study, they can actually compare women that were 60 nanogram per mil and up compared to those that were 20 to 30, and there was an 82% drop in incidence. 82%. It's a massive number to drop the incidence of breast cancer that dramatically by just shifting someone up in their blood range. So all of my patients, men and women coming in, we need to get updated vitamin D all the time and then keep it updated. And then the dosing is really related to where they're at in the range. So if you haven't had an update vitamin D, again, normal range 30 to 100, and yet 50 to 60 and up is really where you want to be if you want to check off that box and crank that lever, get the most leverage out of that vitamin D that you can. That's what the research seems to show. Okay? To leave you with one of the first points that I made, it can be a little daunting to think that we're doing this to ourselves, and there's all these factors that maybe we don't feel we have control over, but there's so many that you do have control over for the health of your family, for your future health. Take a survey, just your own personal survey with some of the content that I share with you today, And there's got to be one or two. I know there's one or two that I'm not doing great with. So take that personal survey, that inventory, and there's whether it may be sleep. Maybe you're looking at your sleep and, man, I'm not getting my sleep down the way I should. I should be more diligent. Or if you want to look at your physical activity and just baby steps, look at some local gyms, or just what type of exercise would you want to do that you would be excited about getting into, and you could maintain and you have fun with it. So maybe it's the exercise piece. Most of us, we're not fantastic 100% with our diet, so you can assess that too. But again, hopefully this was a list of the modifiable factors. Again, over 50% of our cancers, new diagnoses, are attributed to preventable, avoidable, modifiable risk factors. So again, lifestyle, sleep, and exercise. Diet, if you do one thing, look at the Mediterranean diet and copy it. If we look at avoidable things, if you're smoking, if it's pesticides, if it's plastics, check out nitrites. Again, if well water, get some things sorted out and checked out. And then vitamin D should be checked as well. So again, if you have any other questions about this, please leave comments below. If you're checking us out on YouTube, you can leave some comments. Where else do we put this? LinkedIn, you can leave me some messages there too. Certainly on the website, on Facebook, of course. And so if you have any other questions you want me to get back to you with on this, if there's something I didn't mention that you thought, perhaps should have been in here, or you were wondering its influence and its impact on cancer incidence, then just drop me a message as well. Of course, you can get back to us at our clinic. You can check out the clinic at www.osteroncology.com. I'll leave the clinic number here below as well. And get back to us with any questions you have, or questions that you may have generally about integrative oncology. We're here to help you. We're here to help patients fight stronger and fight smarter. It's our mission to get in your corner, and with evidence-based information and clinical implication and application of what we're doing to make an impact in your case, to help you tolerate your treatments and get better outcomes. And so from Oster Oncology, we just want to encourage you to take that inventory, that personal inventory of some of these factors. Be intentional with what you're doing. Be intentional with yourself and your family.